Everybody for joining us today. We're excited to kick off the Plains to Peaks Regional Network. Sarah Brandspiegel is running the webinar, and Zoom is kind of a new technology to me, so if anybody has any concerns or any issues, I think there's a chat function that you can type in any questions or concerns, and feel free to pipe in with any questions also. But I think we'll get started. So my name is Georgiana Venetis, and I am the RNCO lead. I work at the Colorado Department of Public Health and Environment. I oversee the Essentials for Childhood grant and also lead, like I mentioned, the RNCO work. We are also collaborating with some folks from the Colorado School of Public Health from the Program for Injury Prevention, Education, and Research. And I'll let them introduce themselves, and then I think we'll go state by state with some introductions. So Sarah, would you like to start?
Sure, I'm Sarah Brandspiegel. I'm the program manager for the Piper program that Georgie mentioned here at the Colorado School of Public Health. And I'm working with Georgie to coordinate the regional network together. Our hope is that this can be sort of a research to practice, integration, and I'm excited to see you all here. Thanks for being here today.
Carol?
Yeah, and I'm Carol Runyon. I work with Sarah at the School of Public Health Piper program. I'm echoing in Georgie's computer.
Just shut up here.
You're shutting. Okay, and we're still learning how to do the technology. I'm in the same room with Georgie, so we have a little bit of feedback. But I can say more later about the Piper program, but we're excited to be working with the Colorado Health Department and with all of you to do what we can to all move injury control forward in the region.
Thanks, Carol. And now we'd like to start with some introductions from the states. I think I'll kind of do a roll call by state. So if we could start with anybody from Montana, from injury in Montana.
Yes, this is Jeremy Brokaw from the Montana Injury Prevention Program.
Great, thanks, Jeremy. Thanks for joining us.
We also have a couple others.
Yeah, this is Kimberly Cook from the Women's and Men's Health section. We run the Rape Prevention Education Program, and my colleague Katie Cole. Hi,
Great.
Sarah.
Hi, Kimberly. Nice to talk with you.
Thanks for joining us. Is there anybody from the university in Montana or from any of the hospitals in Montana that has joined us? Nope. Okay, great. North Dakota? Do we have anybody from North Dakota joining us? Okay, well, if they jump on later on, we'll have them introduce themselves. South Dakota. Anybody from South Dakota? Okay. Wyoming?
Yeah, this is DL in Wyoming. Hello, everybody.
Hi, DL. How are you? Thanks for joining.
I'm doing all right. Thanks.
Do you have anybody else joining from your department?
Not at this time.
Okay. Anybody from Wyoming, from hospital or university in Wyoming? Okay, great. Nebraska.
Jeannie Beats with the Injury Prevention Program, sitting in for Peg O.G. Ginsburg.
Great, thanks for joining us.
Great to be here. Thank you.
Anybody else from Nebraska? Okay, great. Iowa.
Hi, this is Lisa Roth. I'm with the University of Iowa Injury Prevention Research Center. And I know Carrie Harlan with our Department of Emergency Medicine from our University of Iowa Hospitals and Clinics is also joining us.
Great, thanks for joining us, Lisa and Carrie.
And
I'm
hi,
Maggie.
this is Corey Pisa. I'm also from the University of Iowa.
Thanks for joining us, Corey.
And I'm Maggie Ferguson. I'm sitting in for Benila Hugh. We're at the Department of Public Health.
Great, thanks for joining us, Maggie. Anybody else from Iowa? Okay, great. Utah.
Hi, this is Larry Cook at the University of Utah.
Thanks for joining us, Larry. Anybody else from
Hi.
you? Sorry.
Hi, this is Lenora Olson. Hi, Lenora Olson from the University of Utah.
Thanks for joining us, Lenora. Anybody else from Utah? Okay, Kansas.
Hi, this is Lori Haskett.
Hi, Lori. Thanks for joining us.
I think
Lori Hart from Kansas, and RPE is also on the line.
Hi, Lori. Thanks for joining us. Two Loris from Kansas, spelled differently. Anybody else from Kansas? Okay, Missouri.
Hi, this is Leisha with Missouri.
Thanks for joining us.
This is Karen Clee-Thermos with the Department of Health Office on Women's Health, and we have the RPE program in our office.
Awesome. Thanks for joining us.
And this is Nancy Weaver from the St. Louis University College for Public Health and Social Justice.
Thanks for joining us, Nancy. Anybody else from Missouri? Great. Okay, so I think we'll finally do some Colorado introductions. We have two people in the room with us from Colorado who will introduce themselves, and then we can go around for whoever else is participating.
Hi, this is Lindsay Myers. I'm the branch chief for the Violence and Injury Prevention and Mental Health Promotion branch at the Department of Public Health.
And I'm right next to Lindsay, but this is Colleen Capsamalis, also with the Violence, Injury Prevention, Mental Health branch in Mental Health Promotion branch at CDPHE.
Thanks. Anybody else on the line from Colorado?
Ashley Brooks Russell from the Colorado School of Public Health.
Hi, Ashley. Thanks for joining.
Yes. Christine Demont from Colorado Department of Public Health and Environment, injury epidemiologist.
Hi, Christine. Thanks for joining.
Hi, this is Allison Rose, also from.
Hi, Allison. I could hear you, but you kind of cut out at the end. Thanks for joining.
Emmy Beth from Sally the Thorson. Sorry. Sally Thorson from the Violence and Injury Prevention Program at CDPHE.
Thanks for joining, Sally.
And Emmy Beth from the University of Colorado School of Medicine.
Thanks for joining us.
Hi, Des Runyon from the Kemp Center in the University of Colorado.
Hi, Des. Thanks for joining. Somebody has, I can hear somebody typing. So if you're typing at the same time, if you don't mind just putting your microphone on mute, that would be great. Anybody else from Colorado?
Carolyn DiGiuseppe at Colorado School of Public Health.
Thanks for joining.
Jared Heineman from the Department of Public Health and Environment and the Violence and Injury Prevention Program.
Thanks for joining us, Jared.
Felice Senior, also with the Violence, Injury Prevention, Mental Health Promotion branch at CDPHE.
Hi, Felice.
This is Crystal Garcia with the Violence, Injury Prevention, Mental Health Promotion branch at CDPHE.
Thanks for joining us, Crystal. Anybody else from Colorado?
I'm Laura Schwab-Reese. I'm with the Kemp Center at the University of Colorado.
Thanks for joining us, Laura. Anyone else?
CDPHE.
I think that's Don Sutton, Violence and Injury Prevention State Innovation Model. Anyone else? I think we're good. Okay, great. Well, thank you everybody again for joining us, and bear with us as we kind of work. This is our first time facilitating a call like this, and it's kind of amazing to me that we could have this many people, and I keep seeing faces pop up, so that's pretty awesome technology. But like I said, if you have any questions or concerns, please feel free to type them in the chat. Sarah Brandspiegel is kind of managing the back end of the technology, and so she can address any issues you might have, and also feel free to just chime in whenever you have a question. So we're just going to go over really briefly the purpose of the RNCO, and like I mentioned in my email, most of you took the needs assessment back a few months ago, and we'll be going over some of the results of the needs assessment. We're not going to go over every question, but we will go over the questions that we think will best inform how we can move forward with the RNCO. So just first to give a really brief overview, the RNCO, the Regional Network Collaborative Organization, is funded by the Centers for Disease Control and Prevention. The idea around the RNCO, as I understand it, is to provide coordination across and between all states, regardless of funding status, and collaboration with different injury and violence prevention organizations. In previous years, you guys have worked with Lori Haskett out of Kansas, and we've had an opportunity to talk to Lori and are really excited to learn from Kansas's great experiences with you all. So thank you, Lori, for being present on this webinar today. So I think one of the things that is a little bit different from previous years is that we've been encouraged to kind of invite university folks and hospital folks so that we kind of get a more multidisciplinary approach to how we collaborate this initiative. So that's why you've heard kind of a number of different people on the line. So we're really excited about that. The idea behind this is to share scientific evidence and programmatic policy best practices, and to learn from your experiences and your expertise as well, and also to connect research to practice, which is the important piece between our collaboration between the Colorado School of Public Health, Piper, and the Colorado Department of Public Health and Environment. So we're really excited about that collaboration moving forward. Just to give you, for those of you who are familiar with this, I apologize if this is repetitive, but some of you may not be. The Plains to Peaks region is this region that you see on the map that's kind of in the center. We are 10 states, so it's Montana, North Dakota, South Dakota, Wyoming, Utah, Colorado, Nebraska, Kansas, Iowa, and Missouri. So you can see kind of there are some color codings for those who have received funding and those the core state violence and injury prevention funding, and those who have other types of funding to support their programming. So one of the things that we've been charged with by the CDC is in developing this RNCO is on the logistical side of things. So developing a charter in the first 6 months was their idea. And I don't think we'll focus on that today, but I just want to let everybody know that this is going to be a shared decision-making process with the different network states and organizations that are represented in the Plains to Peaks network. And we plan on taking all the information that we gather from this initial call and putting together a charter that we can hopefully all agree with. And that's something that I will send out after the call. So if anybody has any questions or any input in terms of how they would like to see the charter developed, please feel free to chime in throughout the call. But I think some of the conversation that we have moving forward will help us kind of determine what that looks like. So we're going to jump right into the needs assessment results. And like I said, please feel, I'm going to pause after every slide and give you all an opportunity to kind of chime in if you have any additional. Obviously, most of you have taken this survey, so I imagine that your thoughts are represented in it, but if you feel like you have something additional to add in, please feel free to jump in after each slide. So the needs assessment was developed by the CDC and Safe States with our input in late 2016. It was conducted via an online survey, and it was sent out to different IVP directors and other state health department staff, and like I mentioned, as well as researchers and some hospital folks in the region who focus on injury and violence prevention. So we had 36 responses from our region. Good job. I think we actually had the most responses out of any of the regions, so congratulations, Plains to Peaks Network. We also, Sarah Bransbeagle and I also had an opportunity to conduct phone interviews with the different IVP directors in our region. So that was really a great opportunity, and we really thank you all for taking the time out to do that with us. That was really helpful.
So I think I'm going to jump in here. So to start to go into a little more detail about what we learned in the needs assessment survey, We wanted to highlight some of the questions and the answers that we got, and then, as Georgie said, give you all an opportunity to jump in if there are other things you want to add, or if you think of other things that might not be covered here. So this question was about which additional opportunities or skills would you like to receive to support your program through the RNCO? And a few things jumped out at us here. So the most popular response here was data sources to support evaluation of new or existing programs, but also training opportunities for staff members and evaluation of new or existing programs showed up here as very popular options. So next slide, Georgie. So there was also a write-in option here. So there were some other things that were included that folks added. So funding was one. Coordination and collaboration came up a few times, kind of general, how do we collaborate with others? And then evidence-based information. So we wondered here if anyone wanted to add anything, give us a little more detail about what these things might mean for you, or how you might want to see these operationalized a little bit. Does anyone have thoughts about, you know, specifically what these might look like?
I'm going to switch back to the initial slide so everybody can see kind of the whole chart.
Hi, this is Lenora. I didn't write any of those other three, but it seems to me funding is maybe always generally an issue, and I don't know if someone meant they wanted help with finding funding or writing grants or other things with that. So that was just a thought I had when I saw that list.
Yeah, that's a great point, and kind of some of the more detail we would like to tease out from some of these options.
Any other thoughts? Funding is always an issue for sure. Okay. Well, let's move on, and you can jump in with other ideas. So this question was, describe any programs, studies, interventions, or approaches that you would like to learn more about related to your high priority topic area. So we got some interesting comments here, and I kind of grouped them into categories. So in terms of data, someone brought up integration with electronic medical records as an area to learn more about. And then in terms of programs, some of the things that were mentioned were bystander interventions, long-term driving changes in teens, recovery following sexual assault, also evidence-based programs for increasing seatbelt use and reducing impaired driving. A more general one that we heard a lot also on our phone calls was just what are other states doing and what has worked well or not worked well for them. That could span all the topic areas, but there's I think always a lot of interest here as well, and just, you know, what are folks doing, what's working, what lessons learned can we gain from other states. Also encouraging implementation of screening for TBI into associations, and more on risk and protective factors and how we realistically can affect them. And then we got some policy ideas, environmental change strategies, policy change, monetizing prevention education and outreach under the framework of the ACA, which of course there's a lot changing right now with that, but I think the ACA and how that relates to injury prevention is always going to be an important topic. And then how do we act on systems change? Does anyone have comments? Maybe some of you wrote some of these. Do you have comments about, to say more about which of these jump out for you, or what you may have meant about, you know, some of these focus areas?
This is Jeannie Beats in Nebraska, and I think the one that kind of strikes us right now is the risk and protective factors, because we're working on our state plan, and I think CDC is kind of encouraging us to address those, and I think that's one area we're kind of struggling with, trying to integrate a lot of that into injury prevention when, and trying to match those up with what we wrote in our grant. So that's definitely an area that would be beneficial for us.
That's great feedback. Thanks, Jeannie.
That's great. Is that something that others would be interested in diving into a bit more?
This is DL Wyoming. I think a lot of us, especially who are focusing on unintentional injury prevention, on how can we recreate or pull together the shared risk and protective factors that we see across the unintentional injury topic areas to very similar on how they did the connecting the dots with the violence. So is there a way that we can work towards addressing risk, the shared risk factors, and then bolstering the protective factors that will impact all of our unintentional injury topics, regardless if we're only focusing on, let's say, motor vehicle crashes, or we're only focusing on falls, or if we're only focusing on TBI, or for some states it will be drowning, suffocation, and et cetera. And then, oh, I just lost my train of thought. I'm so sorry.
It's okay. That was great, though. Yeah, I think
that's a great suggestion.
And then what are some other, because a lot of the stuff that we're doing for unintentional injury really focuses on the individual base. So how can we move towards more population-based strategies that are not necessarily policy? Because many of us who are in a state government health agency have restrictions on how we address policy and how we influence and implement policy. So what are some of the other population-based strategies that would be effective in addressing shared risk and protective factors and our unintentional injury topics? I'm totally selfish because I focus on unintentional injuries. So,
makes sense.
And I support our violence, our violence prevention, but my focus is unintentional injury. So what are some other population-based strategies that we can easily implement at a lower cost to show others, yeah, we are doing population-based strategies, but we also need to do the community level or the individual level strategies as well to change these numbers, to move that behavior.
Yeah. Great thoughts. Thanks, DL. Does anyone else have any feedback or thoughts on this question? Okay, on to the next slide. So we also asked you all to indicate what priority the following topics took within your department, your organization or department. And we found in terms of high priorities, systems thinking came out first, child abuse and neglect, and sexual assault. And then moderate priorities were motor vehicle crash, sexual assault, and TBI were kind of tied. It was interesting because sexual assault was a high and moderate priority, so I'm assuming this is kind of a high priority for the folks in this region. Does anybody have anything in addition to say to what they're seeing up here?
Well, it looks to me like they're all pretty high priority.
They are, that is true.
Are these the only ones you asked about? I can't really remember. Or were there others that didn't rate high?
This was all of the options that were provided.
Oh, okay, thanks.
Mm-hmm.
Okay, so we also asked about your strengths related to your high priority topic areas, and what we found that there were some strengths around shared risk and protective factor approach to injury and violence prevention. Leveraging resources was also noted as a strength to meet shared outcomes. Establishing partnerships or coalitions, and data being a strength. Does anybody have anything to add in terms of strengths that they find related to these topic areas within their own departments or organizations?
What I see here is a list of strengths that are very similar to some of the lists of topics that people want to learn more about, which says to me that over time, there are people in the group who can help each other learn about these things, and we just kind of need to sort out you know, who's farther along on some of these and who's farther along on different ones.
Great point, Carol. I think that's absolutely true. And we're very interested, and I think we gleaned some of this from our phone calls with the different IVP directors in our region in terms of strengths. So we look forward to collaborating with a lot of you to kind of showcase some of those strengths and share them with other partners in the region. Okay. So the following question was around challenges you've encountered related to those high priority topic areas that you identified. So these were we broke these down into a couple of different categories. So data was the first category that was kind of a theme throughout the answers in these questions for this question. So systems thinking for data analysis, linking data sources, improving data sources for child abuse and neglect, lack of data was a challenge that I think we heard a lot of, need for local data, and effective data on programs. There was also a category around resources, so lack of funding, which we heard in our previous slide, evaluation support needed, more staff turnover, and local capacity, which is something that I think we definitely heard on our phone calls. Does anybody have anything to add in terms of challenges that they might be facing? Actually, there's more. Yep, sorry, there are more. 3 more buckets: communications, policy, and programs. So under communications, people identified disseminating information to audiences as being a challenge. For policy, political climate limitation on policy activities, as DL just mentioned, a lot of us work for state agencies that have a lot of constraints in terms of how we engage in policy. And finally, programs, lack of evidence-based programs, for example, for sexual assault prevention. Based on those 5 categories, or anything in addition, really, does anybody have anything to add in terms of challenges that they face within their own programs? Great.
Well, and I wonder if among this list, there's some that are more pressing for people.
That's a good question. Does anybody find any of these challenges to be more pressing to them? I know, DL, you already mentioned the policy issue. Can anybody think of anything else in data, resources?
Hi, this is Lenore. Can you go back to the previous slide? Okay, good, thank you.
Yep.
This is Jeannie Beats in Nebraska, and I think for us, addressing the child abuse and neglect and sexual assault is definitely a pressing issue. It's not something we've addressed, and so we don't really have staff that are dedicated to that topic. So we're kind of finding our partners internally. But it's also a matter of the issue is we're not totally educated on that topic, and so we are finding partners, but I think that about not the resources of staff to actually spend the time that's needed on that, that's definitely a pressing issue and a concern for us at this point.
That makes sense. Thanks for sharing. Is anybody else experiencing similar challenges?
So this is Corey, and I'm curious to hear about the experience for some of the non-core states, of which we have the majority in our region. Because I think the core states, it makes a lot of sense for CDC to set these priorities, but non-core states have so many other factors at the state and other agency levels that have a stronger role in dictating the priorities because there aren't, there's no core money. So I'm curious to hear from the non-core states, maybe at a different time or sometime. It would be interesting for me to know how the priorities for their activities are set, and then how they then relate to the priorities that the CDC comes up with. So Georgiana, I'll let you decide if, when the right time to talk about that question is, but I think it's something that would be very interesting for us that really want to support non-core states to hear about.
Yeah, I think that's a great question, Corey. Thanks for asking it. And I think now is a fine time for people to chime in, and if they have any input about how they are the non-core states are prioritizing their topic areas.
Hi, this is Mandy from North Dakota. Can you hear me?
Yes, thanks, Mandy.
Oh, okay. I was having technical difficulties earlier. I guess as far as us being a non-core funded state, we focus on our priorities on where we can get funding. For example, I have funding through our Department of Human Services related to falls, so I'm able to thankfully implement the Stepping On program here because of money that I receive from DHS, and it falls under the Older Americans Act. I guess it's tied to that funding source. I'm not exactly sure where, it's federal funding, but I'm not exactly sure where it comes from. I don't think it's from the CDC. So unfortunately in our state, our priority areas are dictated based on funding. Like we have funding for RPE, and then we do have some money for unintentional poisoning. And thankfully those are two of our high areas that are leading causes of death along with motor vehicles. We do receive funding for our child passenger safety program through our Department of Transportation.
Great, thank you, Mandy.
Mm-hmm.
That makes perfect sense. You're going to choose your priority items based on where the money is. So thanks for sharing that. Anybody else?
Yeah, this is DL in Wyoming. And so for me, the violence prevention efforts are in a different program. They're with our maternal child and health. And I support their endeavors, but our RPE money, our PrEP money, and there's also another set of money that goes into that program that does that. So my focus is on unintentional injury with supporting those others. And so I guess I do have a question. So is the regional network for the next 5 years going to focus solely on those 4 priority areas that was set forth by the CDC for the core VIP? Because I don't know, as an unintentional injury person outside motor vehicle crashes and TBIs, how much the sexual violence prevention, or intimate partner violence, and child abuse and neglect I would be interested in, because child abuse and neglect is not even handled in the health department. It is handled in our DFS. And we do have a Prevent Child Abuse in Wyoming, which is a person of one who leads our child death review and works with DFS when it comes to child abuse and neglect.
Yep. I think that's a great question, and I don't think that you're the only state that's probably wondering the same thing. And no, we will not only be focusing on those 4 priority areas, we will be focusing on what the network needs and where their challenges are and where we can help strengthen your programming. Does that help answer your question a little bit? I mean, I think this call will determine a little bit more of where we're headed and where we should be focused for our region. So I can't specifically tell you we're going to focus on X, Y, and Z in the next 6 months right at this moment. I'm hoping that by the end of this call, based on some of the feedback that we're getting from you all going through these slides, that we will be able to determine focus areas and where we could best help support your programming.
I think that's great.
And this is Lindsay Myers. I also think, the survey itself, something just to keep in mind is that CDC developed the survey, and we had a little leeway to add a few questions, but the categories that they selected obviously were in line with their priorities for the core program, because that's who was developing the survey. Our intent certainly is to have this group meet the needs of this group. And so, you know, for states that have core funding and are interested in those areas, we hope to provide opportunities for, you know, people to engage on those topics. And for other states, you know, there's lots of work going on even in the states that have core funding that aren't related to those 4 topic areas that we also want to talk about and share ideas and learn from you all. So, you know, as Georgie said, I think that the survey itself, if you were one of the people that took it, it made it seem like it was a little locked into those topic areas, and that wasn't our intent necessarily. And CDC is obviously trying to have some consistency across the different regional networks, but our intent is certainly to make it broader and to meet the needs of the group.
Does anybody else have any questions or concerns or feedback to give us at this point? Or, oh. Any questions or concerns moving forward? Okay. Sarah?
Yeah, okay, so this question was about indicating the level of familiarity and interest that you have related to the cross-cutting skills. So these are the top answers that folks gave us in terms of where you all have extensive familiarity and are willing to teach others. Because our real hope with this network is that everyone's going to be learning and teaching each other. We all, I think, have a lot to learn from one another. So data collection, surveillance, and analysis. And that's great since that was also one of the needs or the areas of interest that a lot of people listed as well. So that's great that we have folks with extensive familiarity with that who could teach others. Also preparing reports or manuscripts for publication, and research, data collection, and analysis. So those are the top 3, but there may be others that folks want to chime in with. And, you know, we had our calls with the state IVP directors, but I know there's a lot of other partners on the call as well who have familiarity with these different topics. So I wonder if others have suggestions to add to this list of things you might be willing to teach others.
This is Corey from Iowa, and I think we would be interested in things related to policy, and but not just influencing policy, but what policies are relevant to different agencies based on their priorities. I don't know, Lisa, if you want to add anything.
No, I was thinking the same thing, Corey, that we could, I think, be very useful to the network just in some of the policy brief work that we've done, and maybe working, you know, collaboratively across the states to help develop those, and looking at both core and non-core states. So I think that is definitely an area we have expertise in.
I think I can turn my camera. I think another area that sort of fits in with analysis, but we're always interested in talking about learning ourselves and sharing our experiences with evaluation.
Great, thanks. Thanks, Corey and Lisa.
Yeah, and from here, from the Colorado group, the other thing that we talked about, if it's of interest throughout the region, is, you know, for folks who are perhaps newer at injury control, you know, new staff or programs that have not been around as long, if there's interest to do some sort of basic injury 101 kind of training for folks in the region or on specific topics. For example, child abuse being one that we have particular expertise in here. So whether today or later, I mean, we'd be interested in hearing from folks throughout the region as to whether there's interest in that. I'd like to bring up one other thing, just and this is in the form of a question that we may not want to talk about right now, but there's another group that I'm engaged in that's working with the tribal injury programs throughout, mostly, well, they're all, I guess, at this point, throughout Western states. And I'm wondering the extent to which any of you in state programs are working with tribal entities in your state or region, and the extent to which we might want to bring some of those groups together.
I think that's perfectly appropriate for people to answer right now. If anybody has is involved in any work with tribal injury programs in our region?
Well, this is DL Wyoming. We have the Shoshone and Arapaho here, and I have several partners on the reservation that we help roll out a variety of information. Our Highway Safety Office has a strong relationship with the Department of Transportation on the reservation, and I work often through them to help disseminate motor vehicle related information. But do they actually have an active injury program? They don't. There's a lot of strife that happens on the reservation between the two nations, and that has kind of impeded some of their injury work. And IHS has an assigned person for the Shoshone, but not for the Arapaho, because the Arapaho has backed out of ending. So it's a little convoluted for me, but through my partnership, I'm able to share information, get on the reservation to do work, and I have actually a Tai Chi class that's running on the reservation now, and they're interested in adding more.
Great, thanks, DL. Anybody else sharing experiences with tribal populations in terms of injury prevention programming? Or any responses around the Injury 101 training idea that Carol presented?
The Injury Prevention 101 training that IHS does, it's a pretty good training. I went through it, if no one else has, and it's really good for people who are doing community level work.
Which training was that, DL? I'm sorry.
Oh, it's the Injury Prevention 101 through Indian Health Service.
Okay, great. Thank you. Go ahead.
Yeah, so I think there may be opportunities. I don't know how open that Indian Health Service training is to others or exactly the schedule, but part of what I was wondering is whether there's additional need in the region to do some of that through this network, whether connected to the IHS training or not. And I'd be curious to know if that's of interest.
Would anybody be interested in that type of training that Carol is referring to?
This is DL Wyoming. It would be nice to have like a injury prevention 101 in a box. So that way I can offer that to some of my community partners who may not be familiar with injury prevention per se, or they're new to the world of injury prevention or public health. I've been working with our Highway Safety Office for the past year on really talking about the public to help influence or
Yeah, I think that's a great idea. I don't know if people are familiar with the Injury Prevention 101 that Safe States has. I don't believe you have to access that through a member login, but Carolyn Fowler and others worked on that one, and it's also pretty good, and it's kind of in the box and that it's already packaged online. And then I know that Safe States is, through one of the work groups and committees on Safe States, is working to develop a larger compilation of training resources to help injury directors that are hiring new staff and bringing people that might be from outside the field to kind of compile all of the existing resources, but have it in an easier to use format so that you can actually find it and the links work and it's updated and all of that kind of thing. So I think I totally agree with you, DL. I think a lot of times we just had a new staff member start this week who was, asking for that very thing. And I generally refer people to that Safe States training, at least to start. I think that, Carol's idea of, doing something, or at least offering it might not be appropriate for everyone on the call today, but if there's others that in addition to the web-based trainings that are out there that we could probably put together, some either topic-specific Injury 101 trainings or other types of things and just open it up to a wider variety of partners, whether they usually participate in the Plains to Peak network or not. We want to make those opportunities available, but I just want to make sure people were aware of the one that was on Safe States as well.
Thanks, Lindsay. That's helpful.
Well, why don't we try to zoom through slides? Oh, I've got some echo there. Why don't we zoom through these slides so that we have some time at the end for some more discussion about these topics. Because we've just got a couple more on the needs assessment. So we asked about access to data. Is your office currently able to access all the data it needs? And this was kind of evenly split between yes and no. And then for the next slide, we got some more specific answers about data you're lacking in areas where data collection could be improved. And I won't go through all of these, but you know, lots of different local level data, law enforcement data, child abuse data came up a few times, state sexual assault data. So lots of areas here where we could potentially learn from each other in terms of how to access this data. And then the needs assessment asked, is your department currently able to analyze the data that it does have? And 85 or 86% said yes. And some of the barriers to analysis were needing to hire an epidemiologist, and the programs are driven by funding and not by data. And again, access to EPIs is limited.
Is there anything else anybody would like to add? I can kind of flip back to the slide that talks about data collection and let you read through it for a couple of seconds and respond if there's anything else that you would like to add or any concerns you have, any other concerns you have around data.
Hi, this is Des Runyon. I just was going to comment that in the child abuse data, official statistics, and we've had them for a long time, but there are some major gaps because states code abuse and neglect differently in different states, and so there may be some problems there. One of the things that we've done in a couple different states is collected data about how parents do use harsh discipline, and we know that the rates of harsh discipline are about 10 to 20 times higher than the rates of reported physical abuse in all the states. Harsh discipline we defined as choking, kicking, beating up, knocking down, or hitting with an object someplace other than the buttocks. So it may be that those kind of public surveys would be appropriate to think about. We also know that when we asked parents about shaking their children, that we got a rate in North and South Carolina of 2.6%, which was 150 times more common than actual hospitalizations or deaths from abusive head trauma. And so those kinds of parent survey data might be very useful to add to official statistics on child abuse.
Thanks for that, Des. That's really helpful.
Hi, this is Lenora. When I'm looking at question 16, I see that risk and protective factor data are listed, and that's shown up in several areas over the survey, it appears to me. I'm looking at trends of what you've been showing us.
Do you have any specific questions around that, Lenora?
No, I was just saying I've seen it, risk and protective factors show up several times in different venues on the questions.
Yeah, I think that's a good observation. It definitely seems to be bubbling up as an area that we might want to focus on.
Absolutely.
So it makes me think that it might be really interesting to have a call focused on that type of data, and we maybe share some of the resources we know about, like some of the new mapping stuff that's coming out of the Robert Wood Johnson Foundation, but also maybe talking about how we're connected with our hospitals that are required to do their community assessments, which can also be some really great resources. I mean, sometimes we're the source of that data, but that's one, at least for today, that's one thing that's really driving some bubbling up of some kind of creative approaches to risk and protective factor data. And then on another note, looking at some of the stuff on the more standardized things like the hospital discharge data, we use that type of data a lot, both in our state and nationally, and we certainly would be happy to share, formatting or coding programs. So that might be something maybe worth a survey at some point, just to find out, could we make a coding library just to help with standardized, formatting of different types of variables.
Thanks, Corey. That's really helpful. Anyone else? Okay, I think we're done with the needs assessment slides, and I will briefly talk about some highlights from our conversations with IVP directors in our region. So some of the things that came out on our phone calls that was kind of in alignment with a lot of the things that we heard through the needs assessment too, I believe, is a focus on regional network has been developing relationships, and people would like to see more of that. In-person meetings, it sounded like people in our region were really interested and found in-person meetings to be more useful than maybe the webinar or phone calls. One-on-one TA they found could be very helpful when writing grant applications or trying to problem solve within their programming, particularly around stakeholder issues. I think we heard a lot about, bless you. I think we heard a lot of concerns around partner development and developing kind of different variety of different types of stakeholders and engaging them in some of the programming. Wanting exposure to broader training on injury prevention and public health was another thing that kind of came out in our conversations, and wanting some support to strengthen infrastructure, particularly in those states who kind of have limited capacity in terms of manpower. So those were some of the highlights. Sarah, can you think of anything else that came out of those phone calls? Or does anybody have anything in addition that they would like to add that that isn't really highlighted here that they feel is of concern in their states? Okay, well, thanks again to those of you who participated in those phone calls. That was very helpful. And at this point, I think we just want to open up the conversation again. Aside from the needs assessment, well, we can talk about the needs assessment a little bit more and what stood out for you. I think we've gone through that a little bit. What else are you interested in learning more about? How can we be of support from some of the things that you've heard today on this phone call? Is there anything that's of particular interest to you that you heard highlighted today, or anything that hasn't come up that you would like to see highlighted?
Georgie, this is running again. One of the things that might be very helpful is to have a better sense of what the resources are in each of our states in the region. So I know, for example, that Primary Children's in Utah have a really very active child abuse group. We have one obviously here at the Kemp Center, but I think, and there's the program in injury prevention, Piper, at the University of Colorado. I'm wondering about a more complete enumeration of some of the injury resources across the region.
Yeah, that's a great point, Des. And I think as we go along, something that I would like to see, and people can kind of chime in and give me their feedback on this idea. I created a spreadsheet internally for the School of Public Health and ourselves to kind of go through some of the resources that exist, some of the expertise that exists within our region. So as states identify expertise or resources, it would be great if people can send that to me via email, and I can kind of continue populating this spreadsheet and share it with the region, and also develop some of our training opportunities based on that information.
So would a specific action plan be, this is Des again, would a specific action plan might be to have each of the states send in or prepare a list of the resources that they have in their state that they want to know about, or maybe so we don't make it too long a list, maybe the top 10 resources or the top 12 resources in each state?
Yeah, I think that's a great suggestion. And, I would love to hear from some of the participants in the states. Do people feel comfortable with that? Is that, I know everybody is very busy, doing their 9 to 5, but would people feel comfortable emailing me a list of resources that exist within your state so that we can kind of keep them logged for potential training opportunities? I'm going to take everybody's silence as a yes. Okay.
I think
Yep.
this is Nancy in Missouri. It might be helpful to put out some guidance on what kind of resources you might or most like to know about.
Sure.
Because I imagine that our list would be fairly broad, and maybe even providing a few categories or a structure for those resources might be helpful.
That's a great suggestion. I can do that. Thanks, Nancy. So I have kind of a general question. Do people think that it would be a good idea to pick a potential, kind of feeding off of what Nancy just suggested, to pick a potential focus area for the next few months or so, or do we kind of want to play it by ear, or do you feel more comfortable kind of having, we're going to focus on X for the next 3 months, and then after that's over, we can move on to the next topic area?
This is Corey, and I think having a focus is a really helpful thing, but I wonder if that focus could be more cross-cutting, so no one is sort of left out of the first one, because it seems like really what we want to accomplish in the first 3 months is getting to know each other better.
Yep. That's a great suggestion, Corey. Thank you. So something a little bit more cross-cut, a focus area, but that will potentially reach all of our partners.
I agree. We've heard a lot of conversations about social determinants and protective and risk factors, and I think any of those would provide a really nice launch pad for specific injury topic areas. And we might find some conceptual underpinnings that we could develop collectively that would really inform the work of the particular topic focus groups.
Great. Thank you again, Nancy. Any other suggestions, concerns, comments?
So far, I mean, the response has been largely from the university folks. I'm wondering, from the folks at state health departments, is that sounding like what makes sense to you?
Yes?
Would you ask this question?
What? Okay.
Yes. So I was saying that so far as the answers to Georgie's question have come mostly from university folks, and not to be dismissive of that, but the purpose of the network is to help the states do their work. And so I just want to make sure that we're hearing from the state practitioner participants, and whether what others are saying makes sense for you, or if there's a different direction that makes more sense.
Okay. Well, unfortunately, we're running out of time. Well, we've run out of time, so I really, we just have 2 more slides, and I'll go through them very quickly, and everybody can feel free to email myself or Sarah at the end if you have any other questions or concerns. So we have some ideas for moving forward. Unfortunately, we won't be able to talk a whole lot about this right now, but again, feel free to contact me via email or Sarah, and we can, or by phone, and we can talk about that further. So we wanted to talk kind of a little bit more about the frequency of meetings, and we heard from Lori, the previous RNCO lead, in terms of what that structure looked like, and what worked for you guys. We also want to talk about the potential for learning communities, depending on where states have interest. So we have a lot of ideas, and I'm sorry that we don't have a ton of time to talk about this right now. we already kind of discussed the idea of having a focus area for the network. So I think that that's something that that we can do and kind of take Corey's advice in terms of having that focus area be a little bit more cross-cutting so that everybody can be engaged and involved in that conversation. One-on-one TA opportunities, we're all available to field kind of some one-on-one questions. So please feel free to reach out to us. I know Lori played a huge role in the region in terms of supporting other injury programming in other states. So we're happy to continue doing that for you all. We also discussed kind of tiered learning opportunities that kind of gets at Corey's suggestion in terms of meeting people where they're at. I will send this out in an email. We have developed a blog site so that we can communicate opportunities and list resources within that blog site. I will send that out to you in an email. We will be hosting an in-person meeting. We do not have the date finalized yet. It will be before July 1st, 2017, so stay tuned. I would ask if anybody has other ideas, but in the interest of time, I feel like we should probably just move forward to the final slide, which is next steps. So Sarah and I will send out a doodle poll so that we can schedule monthly meetings moving forward. And again, if there's some pushback in terms of the frequency of meetings, I encourage you to kind of communicate that via email or by phone. Reach out if you are interested in learning about something specifically, or if you're interested in facilitating a learning opportunity. Sarah and my contact information is at the bottom of this slide. I've also emailed all of you, so you should have my contact information in your email. Are there any final questions or thoughts or concerns? Okay. Well, thank you, Sarah, and thank you everybody for participating. I think this has been a great discussion, and look out for some emails coming from either myself or Sarah here in the near future. And we look forward to collaborating the Plains to Peaks Regional Network. Thank you, everybody. Have a great day.
Thank you. Bye.
Bye-bye. Bye.
Thank you. Bye.